Hi guys, this is Dr. Mike Carberry. I want to share with you some information given to me by a good friend of mine, Dr. John Rosa. So Dr. John Rosa is a surrogate on the White House Committee on Opioid Abuse. He is a state and national consultant on opioid, the Opioid Task Force. And he came to our convention in April, which was in Orlando, Florida, April of 2018, and he spoke. And he actually spoke on Friday in the morning, and then he spoke again on Saturday, and he shared with us some of this data. I'm not going to give you his whole presentation, but I do want to share with you some of the stuff he brought to our attention, because you think you know how bad a crisis is until you actually look at the stats. And when we looked at the stats, it's a lot worse than we thought it was. Excuse me. What Dr. Rosa told us is that the moment he presented the stats, they were already obsolete. He said the stats now are much worse than what I'm about to share with you. So if I look at this, you can see a picture on there of Dr. John Rosa, and he's a great guy, former president, I think, of New York Chiropractic College. He's the owner of 14 integrated medical practices in the Washington, D.C. area. And he talks about the opioid crisis. Some of the numbers that he goes over are pretty staggering. So these statistics are pretty alarming. So if you look at them, there are 650,000 prescriptions of opioids are written every day in the United States alone. That's daily. 4,000 start non-medical use of opioids every day in this country. 4,000 people start using opioids and they weren't prescribed to them. And it's just because there's so many out there. 600 people in this country start heroin use, and they found that one of the biggest links to heroin use is opioid use, because opioids are expensive. And as it turns out, heroin is a lot less expensive. So on the street, you can buy one opioid pill anywhere from $10 to $30, and if you can't afford to do that, you could get a heroin fix, I think, for less than $5, which is, I don't know this stuff personally, but that's what I'm being told, and that's kind of scary. So a lot of heroin use in the United States is coming from opioid use. So 3,300 people visit an ER in this country every day because of a problem with an opioid. 58 babies are born addicted every day in this country, to opioids. And on average, 120 in 2015, I think, died a day of an opioid overdose. In 2016, it was 64,000 Americans died from an opioid overdose. That's more than one every 12 minutes. So if you look at that, just that number alone, 64,000, meant that was more than died in the entire 8-year war in Vietnam. More Americans die every year from opioids than died in 8 years in Vietnam. More people die from opioids every year in this country than died in 8 years in Iraq. Also, more Americans die from opioids every year in this country than died in 16 years in Afghanistan. This is pretty incredible numbers. So to trace the origins of the opioid epidemic, he could trace them back, and he's got some information here, but it was a heightened intention to market these opioids to the public through channels that were created by the companies that were making them. There was fraudulent information about how addictive opioid products are. There was actually a study, I believe they said, they found it was less than 3% addiction rate, yet there was only 30-some people in the study. Well, if they're doing a study on opioids, I would imagine, and I don't know this for a fact, but I would imagine if I was a drug company and I was pretty smart, which they pretty much are, I would hire somebody who could do DNA testing to test the metabolism of the opioids I was using and try to find the ones that don't become addicted to it. And you realize that they have the technology to do that. And you realize if they weed out all these people, say they had 5,000 people in the study, they could have weeded out 4,070 of them to get the people that wouldn't get addicted, and therefore end up with a low addiction rate. I don't know if they did that. I'm not saying they did that. I just know that saying it's less than 3% addiction rate is the most ridiculous stat that I've ever heard of. aggressive advertising for the need to prescribe these products by pharmaceutical companies by lobbying to the American Medical Association to get pain established as a fifth vital sign. And they also pretend they're decreasing the scripts of things like OxyContin by creating other opioids that are synthetic, like fentanyl and carfentanil. So it's fentanyl and carfentanil. So we're going to talk about both of these. The points of origin, John said, that he just presented resulted in the following. Pain became the fifth vital sign. The VA in November 1998 sent out a memo to tell doctors that it was wrong to have any soldiers coming back from any of the wars with any pain, and they should be prescribed these drugs. The government gave bonus payments to hospitals for prescribing them. There was minimal or no referral to evidence-based treatment, and there was a massive influx of pharmaceutical money to advertise directly to the consumer. And then there's more recreational use with no stigma because of these drugs. So it's being encouraged, meaning like, do the drug companies care if the pills they're selling are being used for legitimate or non-legitimate purposes? I don't know, but apparently not. So the VA proved to be complicit in the whole problem. Veterans are now 240% more likely to be prescribed an opioid than an average citizen. The suicide rate is 2 times as high as it was in any other war. That's ridiculous. If you look at it, opioid use and abuse by Americans is now rampant and out of control. So opioids are prescribed at an annual rate that could give every American a 30-day supply. States like Alabama, out of every 100 Americans, there's 121 prescriptions written. States like Tennessee, out of every 100 Tennesseans, there's 107 prescriptions written. That doesn't mean everybody gets one. It just means some people are getting more than one prescription. So the United States, which is 4.6% of the world's population, consumes 90+% of the world's opioid medication. 4.6%, the United States consumes 90+% of the world's opioid medication. This is way out of control. Opioids are now the leading cause of death of Americans under the age of 50. Opioids are credited with lowering our life expectancy by itself in the last year. So these new synthetic drugs that are replacing the prescription, so making it look like they're prescribing less, so they're prescribing fentanyl or carfentanil, so it's not OxyContin or oxycodone, so like we're getting control of it. Well, let me tell you about those two drugs. Fentanyl is 50 times stronger than heroin. It's 100 times stronger than morphine. It's a cheaper version of fentanyl. The cheaper version of carfentanil is carfentanil. The potency of carfentanil is 100 times stronger than heroin. It is 5,000 times stronger than morphine. No, I'm sorry, I got that wrong. Carfentanil is 100 times stronger than fentanyl. It is 5,000 times stronger than heroin, and it is 10,000 times stronger than morphine. So we're not making the problem better. We're just shifting things around to make it look better on paper. What Dr. John Rosa told us was, he said, 2016 got worse than 15, 2017 got worse than 2016, and 2018 looks like it's going to be worse than 2017. You hear all this stuff on the news about these opioid crisis and this drugs, and you figure somebody's trying to do something about it. Well, he said all the money in Washington is going towards law enforcement and drug rehab, and nothing to slow or stop the prescription rates. Nothing. So this problem is just going to continue to get worse. See, what you have to do to stop the prescription is get people away from the idea of, oh, I need a drug to hide my pain, to, oh, I need to figure out what's causing my pain and correct that so I no longer have the problem. See, if we made that one shift, which AMI has been advocating for years, if we make that one shift away from symptom control to function change, function improvement, we would end this whole crisis. We have clinics now in 40 some states, 43 states or 42 states, I don't even know how many. But we have clinics that are putting the model that we put together in place. And that model does not use any opioids. What it does is it helps to find the underlying functional cause. The number one diagnosis that results in an opioid or synthetic opioid prescription is back pain. the number one chronic condition that leads to an opioid problem is chronic degenerative arthritis. So we're not stopping this problem. This problem's going to get even worse. We're going to end up with a nation full of zombies if we don't have it already. He talks about what can we do for this, and he says educate doctors about alternatives to opioids. Well, that's what AMI does. We actually train medical people right inside the same room with our chiropractors on how to approach this from a drug-free or a less drug approach, trying to find the cause of the problem, the underlying cause, and we're really good at it. And if you talk to anybody who's using our model, they'll tell you that they get results where they didn't get results before, that people are saying, this is the best thing that ever happened to me. I actually feel like I got rid of my problem. I don't have it anymore. Also, talking to patients and ask for alternatives to opioids and to refuse the opioid, not to take it. Border control, internet, mail, and all of these types of things to try to educate people. Law enforcement, lock up the dealers, not the users. You know, so I could show you a whole bunch of slides he had of poor users that were a husband and wife passed out in their car from opioids with their 2 kids in the back seat, and they were in car seats. And it was horrible. It was just, I mean, this is out of control. And what's happening is the people who are the victims are being called the problem. It's really the dealers, and who the dealers are, unfortunately, are the people prescribing it, but even they're victims. We had one case where a nurse practitioner told us that he was told by his supervisors, he worked in a large clinic before he worked for an AMI clinic, and they had multiple nurse practitioners, and they said, you have the lowest satisfaction rate. And if you don't get your satisfaction rate up, you're going to get fired. Since when does a doctor, or I'm considering a nurse practitioner as a doctor, since when does a doctor want to be popular with his patients? Patients don't want to come to you to be friends. They want to come to you so you can get them back on the right path to health. You know, I never try to be a friend of my patients. I'd rather be their doctor than be their friend, because I'd be doing them a disservice as a doctor by being their friend. So this guy did his research and found out all the other nurse practitioners were prescribing opioids, and that's why their patients liked them so much. So he started increasing his prescription rate as an opioids, and his satisfaction rate became the highest in the company. And they actually wanted him to go around and educate other practitioners about this, and he refused and he quit. This has to stop. These type of mechanisms to prescribe these drugs is not okay. We're turning good, honest Americans into drug addicts. So marketing acute conditions can lead to permanent injury. Just remember, if your patient is on an opioid and they're walking around, it's easier for them to re-injure the injured area and harder for that area to heal because they can't feel it. And they have less body control. Thinking outside the box, integrative medicine, remember, integrated practices means different licenses working together on the same patient. It is not a multidiscipline model. Multidiscipline is, oh, I'm a chiropractor, I want to have a medical person. I'll send you over there for some treatment. That's not integrated. Integrated is all working together. That's the model that AMI teaches. We actually got that model from my wife being a head injury therapist working on a team run by a physiatrist. It was a physical therapist, an occupational therapist, a cognitive therapist, and a speech therapist, all working together in an integrative, collaborative manner to get these patients to a better outcome. And it does come up to a better outcome. That's why we teach integrated. And I think we're the only ones actually teaching an integrated model. And that's because my wife actually worked in it. And we still have our own clinic that we run that is doing the same thing. So awareness, prevention, treating the cause, not the symptoms, I believe is the main thing that is missing in this whole equation. If we get enough of our AMI clients out there putting this model in place, we could stop the opioid crisis tomorrow if we had enough of them. The whole is greater than the sum of its parts, and what John said right here was AMI has done this and set this idea on fire. He has written here, the bystander effect, don't drive by, become part of the solution. And then he ends his talk with this quote by Hippocrates, the greatest medicine of all is teaching people how not to need it. That's what Hippocrates said. And every medical doctor in the country takes the Hippocratic Oath. You could revive a medical doctor's purpose by showing him a way without getting people on abusive drugs or addictive drugs to help people get well through function. They have skills that work in our model that could help you get a better outcome. It's not just a chiropractic with little caveat. This is a medical practice with caveat with chiropractic as an integral part of it. That's what we advocate. That's what we teach. And the reason we're teaching it is because of this. I'm tired of this whole crazy overdose, put people on drugs till we kill them scene. That might be good for Purdue Pharma, the company that makes most of the money off it. I believe the last I heard they were up to $35 billion that they've made from this. Okay, so let them invest that. Let's just cut them off from here on in and come up with a different way to do this, because their problem or their solution created a lot of problems. So thanks for listening. This is Dr. Mike Carberry from Advanced Medical Integration, hoping you're going to join our team.